We already have a number of questions, so let's jump in. So, Dr. Savoy, you mentioned building a culture that reassures patients their information is confidential. Is there something specific you can talk about that you incorporate into your practice to gain more trust from your patients?
That is such a great question. Absolutely. So one of the things that I like to do pretty early on, I mean, I get the benefit of being a family doc, so I see people for a long time. And I think pediatricians get the benefit of this too. If you've thought about it ahead of time and you started to talk to the parent and the kid about the fact that there's some things that are going to be confidential and some things that you're going to need to talk to them about, and that there's this thing called alone time, and that, that you're going to get to be a certain age, and I'm going to have you come and talk to me by yourself. I'm going to ask your mom or your dad to step out of the room for a moment, and then they'll come back in and we'll finish the visit. And then at some point, we're going to get to the part where you're going to have visits by yourself. And what we talk about in those visits is between me and you, unless you tell me you want me to share it with your parent or with your guardian later. And I think that sets the stage, thinking about it like anticipatory guidance, so that even for the parents, it's not a shock where all of a sudden they're getting thrown out of a room and it's something critical. Like, you don't want to wait until you start asking questions about sexual behavior or drugs or alcohol before you start putting the parents out of the room, because now they think there's something going on. Really, you just make it part of your normal, this is the kind of thing that we do. This is how, I operate visits for all teens. And so you make it normalized and you give them the anticipatory guidance so that they're not shocked when it finally happens.
Yeah, that's terrific. Yeah, that's very key. I think it's an awkward moment sometimes when we send parents out of the room, but if we make it just very clear, this is the part where now we're going to be alone, I think it makes it more routine and expected. So another question.
It also helps if you give the teenager a heads up so they come prepared to talk. So
Right.
Some of my teenagers are very, very quiet. And they get really nervous. And so if you tell them ahead of time, hey, you know what, the next visit, definitely going to be sending your mom or dad out, and I'm going to need to talk to you. So if you've got questions, write them down and be ready so that you can tell me about it. So you get them prepared too, because maybe they didn't know it was a safe space to talk to you. And now you sort of open up that door. So when they come back, they're prepared for the fact this is going to happen to them too.
Yeah, no, that's great. I think orienting people from the onset really helps a lot. And we talked a lot about that, even telegraphing, we're going to ask some sensitive questions. We do that to everyone. Another question that came up is, can you share an experience or advice that you found to be really helpful in keeping people more compliant or adherent with PrEP? And I'll say one thing we do is we try to make it as easy and quick as possible. When people are in follow-up for PrEP, there's really not a whole lot of discussion that sometimes people need to have, especially if we're doing this every 3 months. They want to be able to get their swabs done. Certainly if there's anything, there's room for talking about it. But I don't know about you, but one thing there's a premium on is, can we just make it quick?
Yeah. And also I found that helping them understand why you need them to be compliant has been really helpful, so that if they're going to want to stop, you tell them what we need to do to stop ahead of time. So as opposed to making an assumption that once they start it, they're going to stay on it forever. And there's never really an opportunity to say that you don't like the side effects, or you don't like how it feels, or you know what, you're not in a relationship anymore. And so you decided you just don't want to take it anymore. You have to tell them how they're going to get off at the time that you tell them how they're going to get on, so that they know that there's an exit strategy and they don't have to take it on their own. They sort of can actually ask you and have that conversation. And so I found that that's been really helpful, because then what'll happen is that at least they'll notify me or let me know that they want to stop. And then we talk about how to do it, and then how we're going to get back on it when we get to the part where we're ready to get back on it. And if it turns out it's just a side effect or a thing that they didn't like, a lot of times it'll be something as simple as I keep forgetting to take them. And we talk about strategies for how to remember to take them. So picking a time of day, setting an alarm, setting a timer, having a pill box. Even if it's only one pill, you may need a pill box just so that you remember if you took it that day, because some people have really busy lives. And so just giving them ways to do that sometimes is helpful. But I like to think about having an on-ramp and an off-ramp when you're starting the medication, so they know how they're going to get off of it when they want to, and they don't feel like they have to make it up on their own.
Terrific. And very last question for the last 30 seconds that we have. This is a good question about printed, or even I would say digital resources that people could be referred to. Are there things specifically for adolescents, for young adults, that you think might be, that you refer people to or that you hand out about PrEP?
I don't necessarily hand out a lot of documents, but I do send people to websites. So I like to use a lot of the common patient education things, places like the CDC, the ISDA, the AAFP and the AAP all have really great resources, and often they can find information about other things there too, not just about your sexual health. Because remember, you're normalizing this whole thing as part of their visit. So often this is only one piece of the bigger thing they're talking about as their visit. So you're trying to give them resources that way. But I tend to give them the links, because I find that my teenagers tend to lose the paper, but so do their parents. And at least if they have the link, they can put it in their phone and they can look it up later.
Yeah, agreed. I think digital over print. Well, this has been really helpful. Thank you so much. This has been great to do this with you. So
My
thank you to
pleasure.
our audience for your questions. And if any of your colleagues missed today's program, let them know that there is another opportunity for Q&A on Monday, June 28th at noon Eastern Time. For additional clinician and patient resources, please visit CMEO Pharmacist Central at cmeoutfitters.com. Stay safe, and thank you again for participating and for providing the best care to your patients that you can. So thank you, and thank you, Margot. Good to see you.